Hello everyone, welcome to the channel Microbial World. Today we are going to discuss about Mycobacterium tuberculosis, mainly focusing on its morphology, virulence factors, pathogenesis and clinical manifestations. Mycobacterium tuberculosis was first isolated by Robert Koch on 24th March 1882. It is the causative agent of tuberculosis. And in developing countries, tuberculosis is a very serious infection disease and it can kill people. Therefore, it is called a killer disease. And which organ of our body is most affected by tuberculosis? It is the lungs. But it can also spread to other sides of the body. They have thick, complex, lipid-rich waxy cell wall. This high lipid content in the cell wall is called mycolic acid. Now, what is the importance of mycolic acid? When we studied acid-fast staining, we had said that Mycobacterium tuberculosis is an acid-fast bacteria, right? So, it is the mycolic acid that is responsible for the acid fastness of the bacteria. So, they can resist decolorization by a strong acid after staining with carbolfucsin. The name Mycobacterium is derived from the word mold, meaning fungus-like bacterium. Morphology. They measure 0.5 micromuum into 3 micromuum. And as we said, they are acid-fast bacilli, neither gram-positive nor gram-negative. They are straight or slightly curved, thin, rod-shaped bacilli. They are non-sporing, non-motile, non-capsulated bacteria. They appear in single, in pairs or in small clumps. Size depends on the condition of growth and long filamentous, club-sized and branching forms may sometimes be seen. Virulence factors. Cell wall components. So the cell wall contains various lipids, that is mycolic acid. This waxy layer of mycolic acid will protect the bacteria from many host factors, and it also helps the bacteria to resist antibiotics such as beta-lactamases. Muramyl dipeptide from peptidoglycan complexed with mycolic acid can cause granuloma formation. So we will be discussing more about granuloma formation during pathogenesis. Okay. Another virulence factor is code factor trehalose dimycolate. This is a glycolipid derivative of mycolic acid, and it is present on the outer surface of Mycobacterium tuberculosis. Now, what is the function of this glycolipid? It will inhibit the migration of polymorphonuclear leukocytes, that is neutrophils, and they are also responsible for granuloma formation. ESAT6 and CFP10. These are proteins that are part of the ESX1 secretion system. So, what is ESX1 secretion system? It is a specialized protein secretion system found in Mycobacteria, and this system allows Mycobacteria to transport proteins into their thick waxy cell wall and into the extracellular environment or directly into the host cells. So ESAT6 and CFP10 are proteins part of the ESX1 secretion system, and it allows Mycobacterium tuberculosis to escape from phagosomes into the cytoplasm of infected host cells, facilitating its survival and replication. So we know that when a microbe enters into our body, the macrophages engulf the microbe, and then the microbe will be inside the phagosome. Phagosome and lysosome fuses and they form phagolysosome, and then they present the antigen to T helper cells. The T helper cells get activated and kill the microbe, right? So here these proteins are helping Mycobacterium tuberculosis to escape the phagosomes, thereby allowing its growth and multiplication in the cytoplasm of infected host cells. Another virulence factor is protein kinase G. It is a serine or threonine protein kinase. It inhibits phagosome-lysosome fusion, allowing Mycobacterium tuberculosis to survive and replicate within macrophages. Sulfatides. These are also glycolipids present in the cell wall of Mycobacterium tuberculosis. They interfere with macrophage function, and how do they do this? They inhibit phagosome-lysosome fusion and modulate host immune responses. Phospholipases. These are enzymes that catalyze the hydrolysis of phospholipids. And we know that phospholipids are a major component of the cell membrane, right? So, hydrolysis of phospholipids can damage the host cell membrane, disrupt lipid metabolism, and modulate host immune responses. So, Mycobacterium tuberculosis produces phospholipases such as phospholipase C, phospholipase D, and secreted phospholipase A2. Pathogenesis. Human tuberculosis is divided into two forms, primary tuberculosis and secondary tuberculosis. So first let's discuss about primary tuberculosis. Tubercle bacilli enters the host commonly by inhalation, which means when an infected individual coughs or sneezes, droplets containing Mycobacterium tuberculosis are expelled, okay? And when these droplets are inhaled by another person, the tubercle bacilli enters that person through inhalation. And then the bacillus, it is phagocytosed by alveolar macrophages. That means alveolar macrophages will engulf the bacillus will enter the macrophage where they will grow and proliferate. And then the bacillus is carried through the lymphatic to the local hilar lymph node. So the hilar lymph node, these are lymph nodes that is located between the lungs. So the bacillus will be transported through the lymphatics to the hilar lymph node, and in the lymph node, cell-mediated immunity is stimulated. Within 10 days of infection, T lymphocytes produce lymphokines which activate macrophages and lead to form granuloma around the foci of infection. So, when we say the cell-mediated immunity is stimulated, it means T cells are activated, right? Mainly T helper cells are activated and they produce cytokines such as interferon gamma, tumor necrosis factor alpha, interleukin 12 and chemokines also. So, these lymphokines will activate macrophage and lead to form granuloma. Okay, so what is granuloma? Granuloma, it is an organized collection of macrophages, T lymphocytes and other immune cells. Okay, and its function is to wall off the bacteria and prevent their spread, which means the granuloma, it will form a wall in order to contain the bacteria and prevent the further spread of infection. And in some cases, granulomas may undergo caseous necrosis, resulting in the formation of necrotic areas within the granuloma. So, caseous necrosis occurs at the center of the granuloma. Okay, and the term caseous, it is derived from a Latin word which means cheese. That is because it is having a cheese-like appearance. And the lung lesion, it is frequently found in the lower lobe of the lungs. And the lung lesion, it is called Gone focus. Gone focus together with enlarged hilar lymph node forms primary complex, that is Gone complex. Lesions become dormant and produce dense scar tissue which may become calcified. So, calcified complexes can be formed within the lung tissue. Okay, that is a process where calcium salts are deposited in the lung tissue. Okay, and the calcification, it can be observed within nodules, granulomas and also in the areas of scarring. Some bacilli remain in dormant form which when reactivated cause post-primary tuberculosis. So, within the granuloma, Mycobacterium tuberculosis can remain in an inactive state for many years without causing any symptoms. But they can become reactivated when our immunity is compromised, such as when a person has HIV infection or when they use immunosuppressive drugs or during aging or malnutrition. The bacillus, it can get reactivated and cause post-primary tuberculosis, which is also called secondary tuberculosis. Mycobacterium tuberculosis can also disseminate to other organs and tissues, leading to extrapulmonary tuberculosis. So even though the primary site of infection is the lungs, the bacillus, it can spread to other organs and tissues and cause extrapulmonary tuberculosis, about which we will be discussing later. Secondary tuberculosis, which is also called post-primary tuberculosis. So as we said, it is caused by the reactivation of primary lesion or by exogenous reinfection. And secondary tuberculosis mainly affects the upper lobe of the lungs. Two important clinical manifestations of secondary tuberculosis are the presence of caseous necrosis and cavities. So we know that caseous necrosis occurs at the center of the granuloma and it can lead to the formation of necrotic areas, right? And when the necrotic tissue liquefies, that can lead to the formation of cavities in the lungs, okay? And this can facilitate the spread of the bacillus. And these cavities, they can rupture and spread the bacillus throughout our body through the blood vessels. And they can also break into airways, releasing the pathogen in aerosol and sputum. This is called open tuberculosis. Clinical manifestations. So Mycobacterium tuberculosis infection, it can vary depending on an individual's immunity, the site of infection and stage of disease. Okay. So some of the main clinical manifestations are latent tuberculosis infection. So in case of latent tuberculosis infection, the individual will be asymptomatic. Okay, they do not show any symptoms. And this infection can be diagnosed by tests such as positive tuberculin skin test or interferon gamma release assay. Another clinical manifestation is active pulmonary tuberculosis. The symptoms include persistent cough will be there that will last more than 3 weeks. And this is a very common symptom. Another symptom is hemoptysis, which means coughing up blood or bloody sputum. Then there will be pain and discomfort in the chest during coughing and breathing, low-grade fever during afternoon or evening time, profuse sweating during your sleep, loss of appetite and weight loss, fatigue, which means the person will be very tired, breathlessness, and other respiratory symptoms such as wheezing, difficulty breathing, and respiratory distress. Extrapulmonary tuberculosis. So as we said, even though it is the lungs that is mainly affected, the bacilli can also spread to other organs and tissues in our body, right? And this can result in extrapulmonary tuberculosis. So the organs that is mainly affected include lymph node. In the lymph node, it can cause lymphadenitis, which is the enlargement of lymph nodes. And this mainly affects the cervical region, that is the neck region, okay? And in the central nervous system, it can cause meningitis, which is the inflammation of meninges, that is the protective membrane surrounding the brain and the spinal cord. And in the bone and joints, it can cause osteomyelitis and arthritis. And when the genitourinary tract is infected, it can result in dysuria, which is a pain, discomfort, or a burning sensation during urinating. Hematuria, which is the presence of blood during urinating. Or flank pain, which is a discomfort in the area between the upper abdomen and the back. And also infertility. In the pleural lining, it can cause pleural effusion, which is the accumulation of fluid in the pleural cavity that can lead to chest pain and breathlessness. And if the gastrointestinal tract is affected, it can cause abdominal pain, diarrhea, bleeding, and bowel obstruction. Another clinical manifestation seen is miliary tuberculosis. So miliary tuberculosis occurs when the bacteria disseminates throughout our body through the bloodstream. Okay, and that can result in tiny granulomas in multiple organs resembling millet seeds, and that is the reason for the name miliary tuberculosis. Symptoms include fever, weight loss, night sweats, hepatosplenomegaly, which is the inflammation of both the liver and the spleen, and also respiratory or neurological symptoms. So we studied the morphology, virulence factors, pathogenesis and clinical manifestations of Mycobacterium tuberculosis. I hope that the video was useful. Do comment your doubts and subscribe the channel for more informative videos.